Hello everyone, I'm QRS Terry and I'm with Redox, and today I'm joined by the Chief Strategy Officer and CFO of iQuity. Her name is Juiai Polk. Thank you for being here today.
So glad to be with you.
It's great, it's a pleasure, seriously.
Thanks.
So, for the people that are watching and not familiar with iQuity, could you just give us a bit of background?
Sure. So iQuity is a technology that was licensed from Vanderbilt, and our scientists have been in the lab for over 12 years,
Wow.
trying to find a way to identify disease at the earliest onset of symptoms. And we use the blood. We take a blood sample from a patient, and through a course of scientific technology, we were able to identify presence or absence of disease at the earliest onset of symptoms, which is the key. Autoimmune disease is where we're focused, things like multiple sclerosis, Crohn's, colitis, IBS, also fibromyalgia. And when you look at those diseases, they are typically diagnosed by ruling everything out. So they take a very long time.
Wow. So, how did you get started? Because you started a university, and
Right.
grow into an actual company. That's not a traditional thing.
It's hard to do,
Yeah.
and we have great universities in Nashville and in Tennessee generally. Vanderbilt has so much interesting technology that never comes to life. Our co-founders are scientists who started 10 years ago with NIH funding to figure out whether it was even possible to identify disease in the blood using RNA instead of DNA. RNA is a measure of the molecular portrait of what's going on at any given time. And so we are really a unique success story because our founders have come out to help build the company. We've brought in outside capital, so we've got investors who believe in what we're doing. We've also been able to continue to get grant funding, which is non-dilutive to those shareholders. So we're able to continue to do research and development. And now what we're finding is other people are interested in our technology for other uses.
That's awesome. So they're licensing it?
Well, they're not licensed partners yet, but we have found ways to utilize the underlying technology for data analysis, for claims analysis for payers,
Oh, wow.
and other chronic disease care management companies, as well as for pharma that's trying to figure out what do I do with the data that I have and how do I derive insights. You guys have figured this out. How did you do it?
Right. So for emerging companies, everything sounds great, and we both know that's not always the case. What were some of the challenges you faced at iQuity?
So part of the process is finding the right team. And when you're dealing with a scientific challenge and you're dealing with a scientific team, you've got to have a mix. You need to match the scientists with the business people. So we have both healthcare experienced people, startup people. We also have a strong board. We've got a guy who was in the lab business for 35 years who's joined us, who's opened his Rolodex and introduced all sorts of really powerful partners to us. We've reached out within the community to attract interest from data analytics experts as well as others in marketing and the law who can help us really build a business.
That's amazing. So you're in Nashville, Tennessee. How did you put together that team, not being in like Silicon Valley or New York or an emerging startup ecosystem that's like prominent?
So that's an interesting question, but Nashville is Silicon Valley for healthcare. So we have really, really smart people here. The focus initially has always been on healthcare services, evolved to healthcare IT, and now you're seeing more biotech, both pharma device and diagnostics in the city. But the scientific talent is here. The data science talent is growing. And we're not a software developer, so we don't have a lot of that sort of engineering talent need, but even that is growing in Nashville. I work with a lot of startups, so I see this challenge for them.
So what's next for iQuity?
It's interesting when you think about technology and how you have to listen to the market. And so we've been listening, and what we found is that there are ways to use the underlying technology beyond testing. So our company was started with a one and done test for three disease areas. Immediately the scientists and the clinicians wanted to see a monitoring test. Once I've been diagnosed, how do I monitor my patients? But then we found that pharma and payers and others who manage care groups, chronic disease groups, are interested in ways to monitor their patients using our monitoring tests. So where I see this going is an analytics business that largely identifies patients to target and then monitors them for the payers and other parties.
That's amazing. So thank you for your time, Julia.
Yeah.
Where can people find out more about iQuity?
See our website, www.iQuity.com, and you can learn more about us, download a brochure if you want to take one to your provider to tell them more about the tests that we offer.
Alrighty, thank you for your time.
Thank you.